Hi everyone, welcome back to the channel All Things PSW with Winnie. Thank you so much for joining me in my next video. So we will be doing some more questions today, but I just want to thank all of you for your feedback. And I also want to say congratulations to those who have passed the NACC exam. I really do appreciate your feedback and your reviews. A lot of people have been asking me how often I'll post videos. I will be trying to post every week, just so you have a lot of questions and content, just something to help you out as you write your exam. I will also be switching it up, like I said earlier, where I also talk about interview skills and questions just based on my experience as a manager as well. But for now, we're definitely going to get started. So we do have some questions today. So please be sure to like, share, and subscribe. Please tell your colleagues about this channel. I hope that it's very helpful to you. And another question I got is, do you cover all 12 modules in the questions? Yes, I do. I just switch it up based on the video, based on whatever content that I feel people are having a difficult time with. But I have heard from many people, they're saying the exam's getting a little bit more difficult. So I'm hoping that these videos will be very helpful to you. So without further ado, we'll get started. So we do have a few questions. So the first question is, Mary Jane feels fulfilled and has positive feelings. She explains to her colleagues that she feels very healthy. What type of stress is this? A, acute stress. B, eustress. C, burnout. D, chronic stress. So the correct answer is B. It's called eustress. So maybe when you read this question, you said, this sounds very good. It sounds great. There is actually what we call normal stress. So in other videos that you possibly may have watched, we talked about prefixes and suffixes. So EU is a prefix. It comes before an actual word and it means normal. So if we see here, eustress derives from EU, which is you, which means normal. This is a positive form of stress. It has a beneficial effect on health, motivation, performance, emotional well-being. And it's such a thing like, oh, let me take a vacation. Let me go to Cuba. Let me go to Miami. This is a good type of stress. Yes, you might be stressed in the plane a little bit, but you're going to your beautiful vacation. Once you get on the beach, you're going to have a wonderful time. So this is what we call eustress. When we speak of the other stresses here, acute means it's a short-term stress and chronic is a long-term stress. So an example of a short-term stress may be, oh, I need to get surgery for my knee. I'm going to be in the hospital for a little bit of a time. That is acute stress. Chronic stress is, oh my goodness, I just got diagnosed with Parkinson's disease. This is a chronic long-term situation. I now need to take medication. I need physical therapy. I need a walking aid. This is something that's different. And also my family members are affected. The dynamics have shifted because now I have this chronic illness. Now my wife is now my caregiver. My children are now my caregivers. Everything is shifted. I can't work anymore. So these are the types of things that can be an example of chronic stress. And last but not least, burnout is very, very popular, unfortunately. Or I'll say common in the healthcare field right now, just because it's just so much work with COVID and everything. The pandemic really hurt us, but this was there before COVID. It only got amplified with COVID, but burnout is just pretty much where, honestly, physically, emotionally, and mentally, you're exhausted. So that's the definition of burnout. Okay, next question. Mr. Phillips has moved to another province. He is visiting his daughter for 3 weeks. He becomes ill and needs medical care. What type of Medicare is this? A, accessibility. B, comprehensiveness. C, portability. Or D, public administration. So the correct answer for this is C, and that's portability. So I always think of portability like you're portable. If something is portable, you're able to carry it. So you're pretty much carrying your insurance plan to another province in all essence, right? So this is when an individual can keep their healthcare coverage. Okay, I will give an example. I live in Ontario currently, and I'm sure a lot of you do if you're watching my videos because we're talking about the Ontario NACC exam. But let's say I decide to move to Yellowknife. This is now another territory. I'm moving from a province to a territory. So in that time, my healthcare coverage will last me for a short time, even when I move to Yellowknife before I change my address and get my updated health card information. This will last me for a while. So this is when you relocate between a province and or territory, or you become unemployed or travel within Canada, you are covered. So once you move, like we just said, it's your responsibility to form your province or territory and register with that new province or territory. And you have 3 months to do this, which is about 90 days. Comprehensiveness means what is covered in that healthcare plan. What is covered in your insurance plan? Are you able to pay for medically necessary services? So some services actually like drug tests or some certain tests or supplies are covered by OHIP, right? However, there are also some services that are not. For example, going to the dentist is something that's covered in your insurance plan privately. So the comprehensiveness of a dental exam is not included in the comprehensiveness of a provincial insurance plan. So that's what comprehensive means. It's what services are covered. That's pretty much what that means. Accessibility is now, can I get there? Do I live out where maybe there's no form of transportation? Am I in an isolated area? Am I in the reserves? Am I anywhere where I cannot get access to healthcare services? Access is just pretty much, can I receive medically necessary services? Are they close to me? What's the proximity? I'm sure you've heard of some people who get flown into Toronto from the reserves on a helicopter because there's a particular surgery that they need and they're not able to get it there because there's no accessibility for that particular surgery and they have to get flown in. So that's an example of what accessibility means. Last but not least, public administration is when a public administration, like you're pretty much accountable to all, including citizens or any individuals in a particular province or in a particular territory. Next question. This is a true or false. Nonverbal communication is often reflective of one's true feelings. True or false? The answer is true. So I don't know if you know this, but the biggest indicator of one's communication is their nonverbal. And this is what they do. So for example, you can say to someone, are you happy to be with me today at lunch? And they can say, yes, I'm happy, but maybe they're fidgeting, they're rolling their eyes, they're smacking their lips. So right there, you'll know, I don't really believe this person. And it's the same thing with healthcare. In the healthcare field, we always say that the nonverbal speaks more than the verbal. So what you want to see, even with the patient, is that what they say to you verbally, aka spoken words, match the actual behavior, their gestures. Are they rolling their eyes? Are they not looking at you? Eye contact. Is it a cultural thing? So all these things need to match for the message to be true. I'll give you a perfect example. So let's say you're working with someone and then they're told, oh, you have been diagnosed with stage 4 cancer. So you have 3 months to live. This is your prognosis. This is your diagnosis. So a patient, you might say, how do you feel about this? They'll say, I'm fine. Thank you so much for letting me know. But you can see so much shock in their face. You can see distress. You can see that they're just very anxious. Now their shoulders are up. They're tense. You need to give them time to process this particular information. So when you are documenting, you will then document what they said verbally, but you also need to talk about the nonverbal, because this particular patient will go home and maybe have a lot of depression. So these are the things that you need to follow up on and see that, okay, the verbal matches the nonverbal. What does this mean? So like we said here, nonverbal cues typically reflect a person's true feelings, usually involuntary and unconscious. They're set to send messages more accurately than words. However, in verbal communication, like we said, it's what's spoken. Another example is sign language as well. This is another form of communication that we use to communicate with people who cannot hear. Next question. Miss Stacy lives in a high-income neighborhood and can afford several healthcare services. She states that she is able to afford plastic surgery. Mary is her friend and states that she works in a factory and cannot afford the same services even though she requires them medically. What principle is not being upheld? A, beneficence. B, justice. C, non-maleficence. D, autonomy. So I did have a call from a student who just wrote, and she said she had a lot of questions about beneficence, justice, autonomy. And she said, I really wish I looked over it. She passed, but she said she had a lot of questions about this. So a lot of times people can confuse these terms. So we're going to go over them right now just for clarity. But before we go into this kind of speaks to what we were talking about, accessibility. The services are available, but because of the low income that Mary has, she's not able to have them. So they're not comprehensive for her. So make sure you understand these terms. Accessible, yes, because Miss Stacy is getting the services too, right? So yes, they're accessible, but because Mary doesn't have this insurance plan, she doesn't have a comprehensive plan to get this particular surgery that she requires. So, the correct answer is B, which is justice. So justice is just pretty much that everyone should be treated fairly and equally. Unfortunately, it's very difficult. If everyone was treated fairly and equally, the healthcare system might really be crippled just because some services are expensive. As you can see here, Miss Stacy is getting plastic surgery, right? So justice just means fairness to all. However, it's difficult to do that in all essence if it's a financial standpoint. But as a healthcare worker, you must always make sure that you treat everyone fairly and in a just manner. What does this mean? Maybe you have a patient who's from your country and you feel some strong affiliation with them. You want to make sure you bathe them first, brush their teeth, and give them better care than Mr. Smith. That's not justice. You need to treat everybody in a fair manner for you to be just in healthcare. So it's a central idea to our healthcare system in Canada, and people must receive equal access to the same medical services. Okay. So now when we talk about beneficence, it's pretty much to benefit something. Non-maleficence means do no harm. And autonomy just means you're allowing people to be autonomous, which means you're allowing them to have their dignity and make their own decisions about their healthcare. So for example, again, our example of the patient with a stage 4 cancer, you say, do you want some treatment? You say no, and you say, but no, if you get this treatment, you'll be able to live another 4 years. If they say no, you have to respect that decision because it's their autonomy or their right to make that particular decision. Okay. So the next question, where is the sigmoid colon located? A, LUQ, B, RUQ, C, LLQ, and D, RLQ. So if you remember this is speaking to the 4 quadrants that we love so much to look at. I know you have a wonderful diagram in your notebook or your textbook that really shows like the different positions of different organs, where they're located. If you could please review this would absolutely be wonderful. But if you notice, when I wrote this question, I didn't even say left upper quadrant. These are some types of acronyms that you just need to know as a PSW. And then in that way, you'll be able to get this right. So if you saw this, if you say LUQ means Luke, maybe, I know, then of course you would not get it right. So you need to understand a lot of the acronyms as well. But the right answer for this is CLLQ. Is there a way you can learn this? You just have to look at diagrams, to be honest. I'm very into pictures and images, so I always like to kind of learn with pictures as well. So that's my type of learning style, but most people it's not, and that's fine. But I will ask you to please look over the diagram of the 4 quadrants and see what's located in these particular areas. There's no trick to it. It's just something that you need to know and learn. Where's what organs are in the RUQ? All this stuff is stuff you need to know. So again, this question evaluates if you know what's located in your 4 quadrants. We already spoke about them. The sigmoid colon itself is a part of the large intestine. And, look at the diagram of the large intestine as well, that you have the ascending colon, the transverse colon, then it goes down with the descending. So ascending means up, transverse means across, descending means down. Like if I descend downstairs, I'm going down. And then of course the sigmoid colon is the last part of the large intestine. So it's located in the LLQ, which means left lower quadrant. Next question. Mr. Roberts is 88 years old and enjoys running and is still managing his own business. The new PSW mark states, Mr. Roberts, I cannot believe you're still so active and running a business at your age. What is this an example of? A, racism. B, homophobia. C, ageism. D, sexism. The correct answer is C, ageism. So if you look here, we have a lot of isms. So that would be the suffix in this particular area. A lot of the isms are a form of prejudice or discrimination. If you see an ism, something's not going right. You typically, you don't want to see an ism. So in this particular case, the answer is C. So ageism is a way of thinking about older people or older persons based on negative attitudes. So you see him, he's 88. You're thinking he should have retired at 65. Now you're saying, wow, you're running your own business, Mr. Roberts. Wow, that comment itself shows that you're making a negative stereotype about people who are older based on your own preconceived notions and judgments. And that's not fair, right? So this is something you shouldn't do. I think a key lesson for this is just to watch what you say. Once you get employed as a PSW, be very careful about the things that you say verbally, right? So this is a good example. And unfortunately, it happens a lot where people just have an assumption or an idea. Racism, however, is a form of prejudice or discrimination against people based on their membership in a racial or ethnic group. Are you a particular race? Are you a particular color? This is where racism comes into play. Homophobia is a prejudice of people in same-sex relationships or anybody who identifies as a member of the LGBTQ relationship. It does have more after. The name has gotten longer, but just any association or membership in this group and any type of prejudice against that particular person is an example of homophobia. Last but not least, sexism is just intolerating people. So for example, women cannot be bus drivers. Women cannot be construction workers. These are types of feelings towards someone based on their gender. So that's what we call sexism. And again, like I said, these are all unacceptable. You never want to have an ism in your profession. Okay. What is the anatomical position? Select all that apply. So select all that applies, to be honest, are the worst questions, because if you miss one, you've missed the whole question. So every time I see a select all that apply, I do read it over at least 3 times or 6 times just to really understand what are they talking about. Did I give the key concepts? What's going on? So these are our answers. A, the patient's neck is tilted to the left side. B, the face is forward. C, the arms are laid on the chest. D, the back of the hands are facing forward. Or E, the palms are facing forward. So the correct answer for this is B and E. So B is the face is facing forward, and E is the palms are facing forward. So if you don't understand what the anatomical position is, if you could just do me a favor, look it up on Google right now, or go into your textbook and look it up. You'll actually see a diagram of a man. I just remember a man from the textbook, and he's standing upright. He's facing forward, and you can actually see his palms are facing forward, and they're away from his hip. They're outside of his body, and his legs as well are outright. Like, they are not close together. So if you could do me a favor for a few seconds just to look at that so you can have more understanding of this particular question. So what is it? This is where your body, like we said, is standing erect. Your face is forward. Your arms are at the sides, but outside of the hips. They're not by the hips. They're a little outside the hips. And the toes and palms of the hands are facing forward. Please review the diagram. Like I said, it will be very, very helpful. Next question. Mrs. Santos takes her daughter for a young baby wellness check. The pediatrician states that her daughter is below the normal body weight and growth rate. This might promote the doctor to investigate which of the following. A, failure to thrive. B, this is healthy. C, meconium syndrome. D, caregiver neglect. E, nuclear family household. So the correct answer is A and D. So A is failure to thrive, and D is caregiver neglect. So let's look at the question a little bit more. So this lady, Mrs. Santos, has taken her child for a wellness check. If any of your parents, I think you're aware, you need to take your children to get weighed and measured. Are they growing appropriately? By the time they're 6 months, they have to have double their birth weight, things like that. So this lady has taken her child, right? But as she gets there, her daughter is below the normal body weight and growth rate. It could be many factors, but let's look at the question, right? This is not healthy. Anything that is below whatever is recommended is not a healthy thing. So let's eliminate B already. That's definitely not correct. But failure to thrive is when you describe any infant, baby, or children who are below the norms for body weight, growth, or cognitive development. These are the major causes of FTT, which is failure to thrive. So B's out. Meconium is not a syndrome. Meconium is that stool that the baby has in the first 72 hours. So that's already wrong. And I put that there to trick everyone, but there's no such thing as meconium syndrome. Finally, a nuclear family household has nothing to do with this. A nuclear family household is a household that has 2 parents who live with their children. What does it have to do with the question? Nothing. So sometimes you really have to read the question and say, this has nothing to do with the question, so this is not the answer, right? So because of that, I will say maybe the doctor will think this baby or this child or this daughter is being neglected, which is D, or they're just failing to thrive, and they will come up with different strategies and recommendations to ensure that the baby does catch up and have adequate weight, adequate growth, because growth is important for different things. If you think of the growth and development, or when we learn about, an infant, a newborn, a toddler, a preschooler, a middle schooler, then they become an adolescent, then they become a young adult, middle adulthood. all this is a part of growth and development. So it starts at this stage, which is why it's important for the doctors to identify it and report it. If there's actual neglect, it needs to be reported because a child is a minor, a child is a vulnerable person. So these are the types of things that you always look out for. Okay. Next question. What type of discharge would you expect to see on the 10th day after delivery? A. Lochia rubera. B. Lochia serosa. C. Lochia alba. D. Lochia rubra. The correct answer is B. Lochia serosa. So this is another one like meconium syndrome where I kind of made up some things. So if you look A, there's no such thing as Lochia rubera. It's called rubra. So I misspelled that, and sometimes they might do that to throw you off, but you need to be aware of the spelling words as well. So what is all this? What are we talking about? Why? In fact, you're probably thinking, why is this important? Because maybe you're a PSW who is working with somebody who just had a child. And mom maybe has any type of postpartum depression, or mom's just fine, but she's very stressed out. And you need to be able to educate or tell her. I won't even say the word educate, but you just need to be able to reassure her that she's okay. So when it comes to client education, guys, I just want you to know that this is what the nurse does. It's not in your scope as a PSW to educate per se, but this is what you would then inform the nurse, like, oh, Mrs. Smith has Lochia rubra. It's day 4. Is that normal? You know? So these are the types of words and terms that you need to know. So right after somebody gives birth, they have what we call Lochia rubra. And it's red lochia, or the first discharge. It's just honestly like menstrual blood, but really, really thick and heavy, where you have to change pads almost every 2 hours. And these are big pads because it's coming out. You just had a baby. So it's red because there's a large amount of blood. So this lasts about 3 to 5 days, right? After that, we then go into serosa. Serosa is more watery. It's not so much bright red anymore. It's starting to change. And I won't say bright red for rubra either. Sometimes it could be like a dark red, like a metallic kind of dark red. But as you get into serosa, it starts to get a little more thin. It's turning a bit brown or pink. It's no longer that red color. This has blood, it has water, it has red blood cells, it has white blood cells, it has cervical mucus, but again, it's starting to fade in color. So this continues around the 10th day of birth. So if we're looking at this, first we had rubra, which lasted about 5 days, and then from day 6 to about day 10, we had serosa. Now we go into alba. So if you think of alba, if you see somebody and they say someone's albino or albumin, all these things are terming white. So alba is the white one, where now you have that thick white discharge. So it's white or yellowish white, and then it goes way into the 6th week after delivery. So what typically happens when people give birth, guys, is that they say, don't have any sexual intercourse until week 6, when they examine a woman postpartum to make sure she's okay. So what we're expecting at that 6-week mark is that you have Lochia alba because it has fewer red blood cells. Okay, next question. You are working with a WHMIS controlled product. Which of the following is true? A. You can use the product once and remove the label after usage. B. WHMIS covers non-hazardous products only. C. PPE is not required. D. Review the instructions on the MSDS before using the product. So this is another one that another student told me about, that they had a lot of WHMIS questions. And to be honest, when I'm teaching like my PSW classes, I always say WHMIS is a hard one for me. I do find the material a bit dry, but it's still so important. It's very relevant. So this is something you just need to know. So what is WHMIS? Let's summarize that. So WHMIS is pretty much anything. So it stands for Workplace Hazardous Materials Information System. It's just a system that has been compiled in a particular file or a binder to talk about different products and what their hazardous capabilities are. Wash your hands with this, use gloves for this, use a mask for this, wear goggles for this. What happens if by any unfortunate incident you ingest the material, or the material falls on your feet, or you step into it, there's a big puddle and oh my goodness, you fall into it? What do you do? That's the purpose of WHMIS. So it's very important that you understand it. Another thing you need to understand for WHMIS are the actual labels. Know what flammable is, compressed gas, hazardous, biohazard. So what they will do is they'll give you the image and say, what does this mean? So you need to know what it means. So I would just recommend you Google WHMIS labels, and then you know like what the labels mean, so that if you see it in an exam, you're not panicking. It's just something you already have learned. So in this particular question, back to our question before I veer off, they're talking about the controlled product. So what is true? One of these is right. This is not a select all that apply. The correct answer is D. Review the instructions on the MSDS before using the product. So MSDS stands for Material Safety Data Sheet. You also need to know what this is. Okay? So again, like we said, WHMIS is a system that allows for safe management of any product that is hazardous. When you have a product, you do not remove the label. Because if you remove it, I'm not going to identify it. Is it acidic? Like, what is the label? Like, what is this product? So you never remove labels off of products when you are working. It needs to be there so people are aware of what the product is. You also need to, before you even use the product, look into what PPE is required. So the correct answer was D, in that before you even touch the product, review the material safety data sheet to say, what do I need for this product? How do I make it safe for myself? How do I make it safe for my clients? How do I make it safe for my patients? How do I make it safe for the residents? All these things are very, very important. Next question. Which of the following is true related to IV therapy or intravenous therapy? A. Central intravenous lines are located far from the heart. B. Catheters inserted into the arm are peripherally inserted central catheters. C. Subcutaneous infusion therapy means therapy in the muscle. And D. Hyperalimentation means the alimentary canal has an infection. So I'm looking at this question and I can see how people might be overwhelmed with the words. There are a lot of new words, but we will go through it. The correct answer is actually B. Catheters inserted into the arm are peripherally inserted central catheters. So let's just go through each one. So the first one is central intravenous lines are located far from the heart. You need to know what a central IV is. So all central are located close to the heart, which is why they call it central, because it's located to the center of your body where the heart is located. So you need to know what an IV is. So a vein is something that you have in your body, and if you have a catheter that you insert along with the needle, then whatever substance that you are getting will go straight into your vein, and that's the quickest way to get medication. So let's say I take my Tylenol. It will take about 30 to 45 minutes for it to go to like the first pass effect and all this stuff, get broken down by my liver. I might feel the effects a little bit longer. But if I get any type of medication intravenously, the effect is immediate. It's kind of like smoking a cigarette. If anyone here is a smoker, you feel the effect right away because it goes right into that blood-brain barrier right away. So it's the same thing. So intravenous therapy is very quick. This is why in an emergency situation, they will start an IV and give you the medication, because we are guaranteed that the medication will be available immediately. So central, close to the heart. So we said B is the right answer. So I'm going to skip it for a bit. Let me go to C. C, subcutaneous infusion therapy means therapy in the muscle. So if you remember anything that you learned, subcutaneous means in the fatty layer. It's not the muscle. So subcutaneous is when you pinch someone, kind of like, you're getting a needle. If you're diabetic, you're giving yourself your insulin, you want to pinch it in the fat. So that's subcutaneous. And last but not least, hyperalimentation has nothing to do with an infection. It's just a way that you feed somebody. It's a type of feeding. This was in the module where we did like digestive system and everything. Infection, no. If you've watched my other videos, I typically say a big sign of infection or a big suffix is itis, which is itis. This shows that you have an infection. So again, it's important to understand enteral nutrition and intravenous therapy. They put them together, but they're very different. So people always ask me, Winnie, what's the difference? Enteral is to do with feeding, and intravenous is just the therapy in the veins, right? So we spoke about the central IVs already. And then we said anything that is outside is what we call a PIC, which is a peripherally inserted central catheter. So if we use the word periphery, it just means something that's kind of away from you and not very close. So if it's in the arm, it's not as close to the heart, but it'll still go to the heart. So that's why we call it peripherally inserted central catheter. And yeah. So I think we've covered everything. So this is also the last thing for hyperalimentation is where somebody receives all the nutrients in the vein. Next question. Which of the following are signs of cerebral palsy? Select all that apply. So this is another select all that apply. A, needing mechanical ventilation. B, having blood problems. C, having seizures. D, muscle weakness. E, low birth weight. So the correct answer is all of the above. A, B, C, D, and E. So all of these are correct. So we call cerebral palsy CP, and this is a disorder that affects the muscle control and is caused by an injury and permanently affects body movement, muscle coordination, and balance. It also affects the part of the brain that controls all your movements with your muscle. So other symptoms are difficulty or inability to speak, muscle weakness. So pretty much if you go and review these particular things or review cerebral palsy, another common one that they ask about is Down syndrome. These things will help very much for you to have understanding of what this really is. So just make sure you review these things. So these are called congenital disorders, where it means you were born with it. So you just need to understand what it is so you're able to care for a particular child who has these issues or these health concerns. Next question. Which of the following type of abnormal breathing pattern is associated with diabetes? A, Cheyne-Stokes. B, bradypnea. C, Kussmaul respirations. D, hyperventilation. The correct answer is C. So just so you know, guys, if you ever take any of our mock exams, or if you, of course, have been reviewing our videos, I had a student and she sent me a message and she said, I just feel you're making this really hard. You're using all these words. I said, well, the exam is hard. You have to know these words because They want you to know these words because you're getting into the healthcare field. And as you know, a lot of nurses are leaving the profession. So they want to make sure that they're really trusting all the patients with somebody who is qualified and knows this. So will they ask you about Cheyne-Stokes? Yes. For this particular one, the correct answer is C, which is Kussmaul. So we're going to go through these as well. So the correct answer is Kussmaul. Every time I see Kussmaul, I think of diabetes, right? So what is Kussmaul respiration? These are deep and rapid respiration, which are characterized when you're in the acidic state or acidosis state of diabetes. This is when a patient who is diabetic is in an acidic state. Cheyne-Stokes is always where you are in assisting with dying. This is where you have moments of apnea, which apnea means absence of breathing, and then you breathe a little bit and then you stop again. This is when you know that death is imminent. Someone's about to die, right? Brady means slow, bradycardia, bradypnea. So cardia is to do with the heart rate, pnea is to do with the respiratory. If you see the word Brady, which is the prefix, you know something is slow. If you see the prefix tachy, you know it's fast, which is tachycardia, high heart rate, tachypnea, which is high breathing rate. So here, this is slow heart rate. So this has nothing to do with diabetes right now. So that's not my answer. Finally, hyperventilation is rapid and deeper respiration. For example, I really, let's say, panic if I'm on a plane, then the anxiety might result in hyperventilation. Other reasons may be infection or pain, but hyperventilation is just a state of breathing very, very quickly and very, very rapidly. But again, if I go back and I read my question, because I've looked at this, I want to make sure I get this right. I've read my question 3 times. I know that they're asking about diabetes. I know that my correct answer for this is C, which is Kussmaul respiration. Cheyne-Stokes, like we said, is for palliative. Brady means slow, nothing to do with that. Hyperventilation, nothing to do with that as well. So the correct answer is C. All right, guys. So thank you so much for another video with me. This was my final question. Please continue to send all your suggestions. And again, like I said, I really do appreciate all of you who have been commenting or saying you're sharing this with your colleagues. If you just started the PSW course, I really would encourage you to do these questions just so you have more understanding. There's a lot in those 12 modules, and I just want to make sure you're not confused when you write the exam or overwhelmed. So yeah, again, like I said, I will be posting every week, and I hope that that works for everyone. But I won't be posting questions only. I'll also post other contents and talk to other PSWs as well and just see if they can give you some feedback on what the day in the life as a PSW is. I really do value all PSWs. I was a PSW for many, many years before I became a nurse, which is why I actually decided to start this channel, because I really know that being a PSW, you are really at the front of this particular healthcare world. But I'm really hoping that the videos help you. So don't forget to comment, share, like, subscribe, and share this video with your colleagues. And I will see you guys, or I will talk to you guys a week from now. Thank you.